Today I'd like to talk to you about a procedure in the office that can sometimes generate a lot of questions among our patients. However, it's really an important concept, and it's something that is designed to be about you, the patient, to help you get what you want out of your experience here at our office. And that would be the concept of re-exams. We often get questions about, why do I have to do a re-exam? Or I've never had a re-exam at a chiropractor's office before. And I understand that anytime there's uncertainty, it can create a little confusion and it can be concerning. And so we'd like to clear that up for you today and help you to understand why we do that. So a lot of times people only use their pain as an indicator of whether they need care or care should start or be done. And pain is a very important indicator that we use to monitor your care and how what we're doing is helping you, but it is not the only indicator that we use, nor should it be if we want to provide you with the best health care that we can. We know that pain is often a poor indicator of our health. And to use an example to help get that point across, I can think of a couple situations, even in my own family, with people that had no pain or no real symptoms whatsoever and were diagnosed with cancer. I've had people in my family that had no real health conditions or pain going on and died of a sudden heart attack. And so those things can happen. And so using pain as the only indicator of whether you need health care is not always the best option. So we use things like orthopedic and neurological tests. We use things like thermography and surface EMG. We use things like range of motion, posture. These are all indicators of how we diagnose what's wrong in your spine and what we need to do to correct those subluxations or misalignments. So I'm going to show you an example of a patient with a thermography scan that we did. So this is an example of a patient that came in, and the purpose of this video is not to teach you everything there is to know about thermography, but thermography measures the temperature from side to side of the spine in each level and compares them. And you should be within a half a degree centigrade temperature-wise from side to side of your spine as we do this scan. And this is the goal on this paper, to have a yellow scan. You can see when this gentleman started out care, he had areas outside of the normal range, and those were areas where he did have subluxations in his spine. And so over a course of a couple of months, he was able to achieve a normal scan. My point in bringing this up is that this gentleman was out of pain for the most part within a week or two. However, it took a couple months for his scan to get to normal and to normalize his thermography scan, which tells us that even though he was out of pain, we still hadn't achieved maximum or optimum function as far as his spinal and neurological function was concerned. So let's just discuss a couple other indicators that we may use. It's very common for a patient to come in who has an injury to their neck and a pinched nerve and maybe have weakness of their upper extremity of their arm. And we want to monitor that. So again, maybe the pain has gone in the neck and the person's sleeping better through the night, and those indicators are better, but maybe they still have a weakness in that arm. We need to reevaluate that. Maybe when we do a compression test where we lean the person's head to the side and compress, they have pain on that. Maybe after a few adjustments, the pain or the headaches or the migraines that they came with are gone, but still when we lean their head to the side and compress it, they have pain with that, which is an indicator that more care is necessary. So we typically do our re-exams at a cycle of once a month or every 30 days so we can monitor your progress and make sure that you're getting the appropriate amount of care. So hopefully this video clears up a few things for you to help you understand that, look, how you feel is why you're here for the most part, and that's very important to us. We do not want to provide you with more care than you need. However, we do want to correct the cause of the problem that you came here with. so that we can prevent future arthritic, degenerative, and debilitating chronic spinal conditions from developing in your spine. Have a wonderful day. We'll see you next time.